a great time here to get things planted up. You know, the average golfer.
Oh, please join us. Send us a question. Hi, I'm Shelly Irwin. Thanks for joining us for Ask the. And joining us tonight, we have the experts Roy Shaw, Meredith Miller, Dr. Michael Olgren, all members of the medical field in their own respects. Let's see how these first responders respond to all of my questions in the special edition. So thanks, of course, for joining us tonight. All right, this is called the elevator pitch and how you spend your day and how you are an emergency responder. Let's start with you, Dr. Olgren. How do you spend your day?
Well, when I come into my shift, I usually will take report from the physician ahead of me. They may have a couple of patients they haven't been able to finish up quite yet, and then once I've learned about those patients so I can finish up their care, I pick up the new patients that are inevitably waiting. And it's taking care of whoever comes in, whether it's a child with a cold or someone who's been struck by a vehicle.
Yes, so you're hanging out in the emergency room.
Yes.
St. Mary's, good institution. Meredith, are you driving the ambulance?
I do. So my day typically starts off, I pick up the ambulance, and basically from that point on we respond to 911 emergencies and non-emergent calls for the duration of our shifts.
Right. Roy Shaw, Bertie tells me you're retired.
I still keep my license current and all my continuing ed. It's great being a paramedic. I actually worked with Meredith at AMR for a good amount of time, and now I'm focusing more on preventative education, obviously through basic life support, first aid, advanced cardiac life support education through e-learning. But I guess the most exciting part of my job is actually responding to people's questions through a video blog that I do, and where they can ask me and we can take some time to kind of armchair paramedic. What would you do to prevent it? What would you do to react to it? And how could we make sure that the victim maybe has another day tomorrow to live? So that's how I spend most of my days, as well as being part of the team over at Pro Trainings.
Yes. What's the role of a paramedic?
Well, we respond to someone's home, to a scene. Our responsibility is to stabilize and to transport or intervene the best we can, and to transport them as safe as we can to an emergency room department so they can be further treated and evaluated.
Dr. Olgren, who makes up your team? I trust the paramedic is part of your team.
They are part of the larger team. We have, in the emergency department, I work at St. Mary's, we have 15 physicians, 12 mid-level providers, and then a staff of nurses and technicians, x-ray, the lab department, all come together to provide the best care we can to the patient.
And you're there 100%, giving 110% at 3 in the morning as you would be at high noon.
That's correct. We have to be ready at all times for anything that walks through the door. It isn't always like the TV shows where we're sending everybody up to the operating room, but you never know what's going to come in next, and you don't know what time it's going to be. 2 in the morning might be totally calm, or it could be chaos, controlled chaos.
ProTrainings.com, what's that all about?
It's about actually teaching people before it happens. And I really liked the comment earlier about prevention being vitally important. And you know, I've always joked around with people when they'd say, how do I survive cardiac arrest? And obviously basic life support CPR is a huge part of that once cardiac arrest has happened. But one thing that we like to say is, how can we prevent it from happening? The best way to survive cardiac arrest is to never have one. And so how can we continue the wellness? How can we be active, eat correctly? But then what do we do? Because we find in pre-hospital medicine as well as in hospital ER that it's everything that happened from the moment the person's heart stopped and they weren't circulating oxygenated blood till the moment we can begin to provide some form of recirculation of partial oxygenation that may open that window of opportunity, not guarantee survival, but at least keep somewhat of a viable patient viable, so that we hope to get them to the hospital through the paramedics on the ambulance, continuing that stability, continuing that resuscitation or treatment until they get into the arms of the doctors and the nurses in-house, where they can stabilize further and then fix the problem definitively and hope for a new tomorrow with that patient.
Hence all the communication that you have to do. Meredith, somebody standing next to me, they are giving me signs that they have a heart attack, they drop. What are my responsibilities?
Well, as a bystander,
Yes.
our goal is to have you dial 911 as quickly as you can to activate the system, to get the fire department to arrive as quickly as possible. Some institutions have AEDs. Maybe people around will know where one is located. Obviously, electrical power to the heart is the best. However, in the event that an AED isn't available, a bystander just doing compressions on the chest is proving to be pretty successful. Again, not guaranteeing a return of circulation, but at least helping that patient have that potential of a return of circulation. So when we do arrive, we can intervene on a more advanced level. But doing just chest compressions and forgoing the mouth-to-mouth is very crucial for patient survival, or attempting to survive.
So those are continuous chest compressions.
Just press hard, fast and hard and deep, and that's just what we really would like the public to just do if they see or witness someone collapsing into a cardiac arrest.
How important is it to, Dr. Olgren, to stop bleeding in an emergency situation?
Well, you do want to stop it. We don't really recommend tourniquets these days like the old days, mostly direct pressure with whatever you have. If you have a clean gauze, great. If not, use a shirt, use your hand if you have to. You want to be careful afterwards to wash up, but if you've got someone with large amount of bleeding, that's the thing to do.
Let's talk a little bit about first aid. I'll turn to you first, Roy. Do we all need a first aid kit in our hands?
I think it's a great idea to have a first aid kit. I'm not sure everybody needs the 105-piecer, if you get what I'm saying. I mean, there's a lot of different first aid kits.
Safety pins come in a lot of
You
sizes.
never know when you might need a safety clip. You never know when you pop a button, right? And that's first aid as well. But I've always said sometimes we just forego getting that 105-piece because it has 90% of the stuff you'll hardly ever use and about 2% of what you really could use. One could go to the local dollar store for most part and get enough 4x4, 5x9 bandages, some gauze, that's for the control of bleeding obviously, latex and especially non-latex for those who have allergies. Vinyl gloves and nitrile gloves are very abundant nowadays at almost every pharmacy or even dollar store that you come up to. So usually gloves, gauze, and a one-way valve for a CPR shield, unless they're going to do just continuous compression-only CPR, which is absolutely great. I mean, especially compared to nothing at all. At least we're compressing the heart and getting some level of circulation, so they don't have to have that CPR shield nowadays to do benefit. They need to understand that that data is pretty clear. At least in the first 6 to 8 minutes, we're still doing a great deal of good for the patient until EMS providers can come with the right equipment.
You want those compressions with infants through the 90-year-old?
Yeah, if you've got infants, there's a little bit of a difference in how those might be delivered. Usually you use 2 fingers or the thumbs. Yeah, I'm getting a little technical when it comes to healthcare provider level CPR certification versus general lay public education. We're just talking about fast compressions greater than 100 a minute. If you're talking about infants and children, we want to go at least 1/3 of the depth. Let's get out of the inches. Nobody has a tape measure with them.
Right.
Let's go at least deep, maybe 1/3 or greater of the chest. And then with an adult, we're doing the same thing, deep, fast, and hard.
Great. Ready to talk ambulance etiquette? All right, I'm driving on the highway. I hear the sound of an ambulance or a fire truck. What do I do?
We don't want you to panic. We don't want you to slam on the brakes. We don't want you to cross over the center line. We would just like you to signal, slow down, and just pull to the right and allow the police, fire, and ambulances to pass safely. And when we do, then just slowly merge back into traffic, being cautious that the people behind you may not be paying attention. And when we do come into an intersection, we're to stop, look and clear, but that doesn't mean everybody else is. So to be cautious, if you hear sirens, be vigilant about where it could possibly be coming from, and just slow down and pull to the right. That's the safest method for the public.
But you are required to slow down. We always worry about you being too quick, but you're required to slow down
Absolutely,
too.
absolutely. We definitely take safety as #1 driving lights and sirens because there's so much risk involved with driving. We're going faster than the speed limit, just roughly a little bit over, about 10 miles over the speed limit, but we have to get to the scene quickly and safely. But to do that, we have to get the public to move out of our way
Yeah.
by stopping and pulling to the right.
Yeah. Dr. Olgren, let's open up a can of worms. You see everything, as you mentioned, from the common cold to the major trauma. Let's talk prevention. Are there some, 2 or 3 big time, do this and maybe I won't ever see you in the emergency room? Take it away.
Well, there are so many areas where we can do better as a public with
Yes.
prevention. Right now, for example, when you're going out into woodsy area, wear DEET to prevent mosquito bites. There's some West Nile virus going around right now, and to prevent that, you're going to use the bug spray if you're going to be outside. Wearing sunscreen when you're outside in the summer to prevent sunburn. Washing your hands. That's something all of us need to do. Healthcare providers are learning that lesson as well. Wash your hands,
And let me
cough
stop you
into
there.
your elbow.
Because we're spreading things we can't see. Is that
Right.
correct? Yeah.
Right. The germs are small. You can't see them. You don't know they're there. And so any time you have contact you're not sure about, just wash your hands. I wash my hands before and after every patient I see.
Great. Put a pause on that. We're going to take a quick break, show you what's coming up next week. Right now, ask the emergency responder. Were you a Girl Scout? Were you a Boy Scout? Well, we're going to ask the Scoutmaster, so stay tuned for that. Right now, the emergency responders responding to my questions. All right, so there's some common sense venue. I trust if you're a biker, wear a helmet.
Absolutely. Whether it's a motorcycle or a regular bicycle, skateboard, windboard, anywhere where your head might be in danger. We're finding more and more evidence about how concussions, even though you can survive a concussion, sometimes they add up and cause trouble down the road with the ability to learn and so forth.
Because boom, your head's hitting that pavement, that brain isn't tied in that tightly.
No.
With the dural sheath, you're moving around.
It definitely bounces around, and we've seen over the years many head injuries from people who weren't wearing helmets, whether on a bicycle or a motorcycle. And we definitely want to protect the brain.
Yep. How important is it to wear a seat belt? I know it's legal, but
It's very important. It can save your life if you're hitting something or something hits you. It protects you in the vehicle to have it on. It's a means to protect you in the seat, and to, if the crash is so violent, to keep you within the vehicle. The cars are built to keep you safe in the compartment.
Right.
We don't want people to be ejected, so it saves people from being ejected from the vehicles if they are wearing their seatbelts.
let's stay on the topic of a motor vehicle accident. Wear your seat belt. Speed. You hear that speed is obviously you also hear that cars cross the median line a lot. Why does that happen?
There's a lot of distractions in the vehicles between the radios, the cell phones, text messaging, which is obviously not legal. But there's just so many distractions, and the drivers, I don't think, are putting driving as number one when they get behind the wheel. And I think it's putting a lot of the community at risk when they're picking up their cell phone and using it while they're driving.
And the jaws of life. What are these?
That's a tool that the fire department will use if somebody's entrapped in their vehicle that's been severely damaged in the crash, and it just helps pop doors, spread the doors so we can get the patients out.
Yeah. Roy, I understand we can learn CPR first aid online.
Absolutely.
Yeah.
You know, we
and who should be learning this?
Everybody should be learning.
Yeah.
As soon as they can understand, we have records of children doing really great CPR on their parents or on their grandparents before we arrive, and it making a difference. So, yeah, there's some size differences there that might affect that, but at least they're trying, and they're going to feel better knowing that they tried to do something. One of the messages that I try to get out most of all is to think more about possible emergencies before they happen. I think sometimes we just don't pre-plan, whether that's getting out of the house before a fire, whether that's going and getting a ladder and having it nearby the frozen pond when you're ice skating so that you can extend something out to them to draw them in if they break through the ice, all the way through to carbon monoxide testers. If somebody's starting to have angina, which is chest pain that's vague in nature, it comes, it goes maybe, but they can still function. All of these things are telltale signs that we should be thinking about, what would I do if these things happened? Because in most cases, the biggest enemy we have is that people don't do anything. It happens, they freeze from panic or fear or anxiety, and then there's a long delay before they activate EMS, before they start first care, and basically by activating EMS, even if they don't know what to do because they didn't go online to get even the basic awareness level education that's free through watching CPR and first aid videos, they can be talked through it with the help of dispatchers who are trained and qualified to do that very well. They can bring a lot of peace to that family. And I guess the other part is understanding that when they try something, they can't make it worse. They cannot make it worse. They can only make it better unless they're violently trying to do something wrong. So fearing that if they get involved with a loved one or even a stranger and they're going to get sued, which we have a Good Samaritan Act to protect them from that they're going to hurt the person. You can't hurt a dead person. You can only make them better. That they're going to catch a disease. Well, now we can do a lot of things without ever coming in contact with blood and body fluids to help. None of that should get in the way of them caring enough to call and then doing what they can do. But preparation, training ahead of time is going to be the key to that success.
You witness an accident. Obviously, we're all calling 911. What's the other responsibility, Dr. Olgren, of say there is a car that starts to burn, or someone is yelling for help inside the car? What's the action item here?
Well, every person needs to make their own judgment about what they're capable of doing. For someone who's had training, they may feel more comfortable about potentially trying to remove someone from a burning vehicle, but that you don't want to put yourself in danger. A dead hero is not really any good to anybody either. So definitely call 911 first, and then assess what your capabilities are. If it's a rollover car accident, and maybe you can best help the scene by parking your car to protect that vehicle from other oncoming vehicles. There's a lot of things you can do that are not necessarily putting yourself at risk in that kind of a situation.
Meredith, is there constant communication once you get that signal from 911 that there's been a car accident? Are you in constant, what's happening in the ambulance as you're traveling to that accident?
Depends the severity of the accident. Sometimes the dispatchers are aware of how severe it is based on what the callers are saying to them. So we're mentally preparing what resources do we need to get, how many patients do we have, and we're trying to plan it out before we get on scene. So when we get on scene, the decisions have started to be made. Once we get on scene, we evaluate what the situation is. If we need to call the helicopter in or additional ambulances, we go ahead and do so. If there's a lot of people involved, we'll alert the hospitals and inform them of the amount of patients and the severity so that they can get prepared long before we are even ready to leave.
How do you determine which hospital to go to?
A lot of times it's patient preference, or depending on the problem that the person may have. Some hospitals have facilities that others do not, so we would have to go to that facility where they would be best treated. Also, we go by closest, most appropriate to the hospital.
Yeah, Dr. Olgren, you brought this up in the beginning. You might see a bad cold come through the emergency department. You might obviously see the worst case scenario. What's your education to us here?
Well, everyone should use their judgment. I am not one of those that would discourage people from coming to the emergency department. I feel that if you don't know, you don't know. If you're concerned about yourself or a loved one and you can't get in to see your primary care physician or a clinic, then you don't have a lot of choice. You go again to the level of your training, and first, if it's not an emergent situation and you have a doctor to call, definitely call that doctor or their service, and they oftentimes will give you advice. They will listen to your problem and say, well, that sounds like it's more than what we can take care of. You're going to have to go to the emergency department. So I know there's some people that speak out against, people who shouldn't be in the emergency department, but I I don't ever scold anyone for coming to the emergency department. They're trying to do the best that they can for themselves or their loved ones.
You must be up on this, but are you prepared for worst-case scenarios in our area with any type of, triage necessities, etc.?
Oh yes, we do extensive disaster preparedness. We have a committee that meets monthly. We go over various scenarios, if there were a tornado, if there were a large bomb, if there were a factory fire, all kinds of different situations that could come up, and we prepare and we practice for them. Twice a year or more, we have drills where we'll have mock patients come in, oftentimes college students, and we'll pretend how would we handle that influx of volume.
Meredith, obviously you must have to have training drills, and our people are...
We sometimes will participate with the hospitals. We also will do triage tag day, so we can get comfortable using triage tags. What those are there's a major casualty, there's a lot of people involved. We'll tag people so that the other responders know the severity of a patient, and when they go through the system from the scene to the hospital, they can stay categorized. Then again, people can change their category from critical to not so severe, but the tags are just a great nonverbal communication between responders. So we practice with those as well as doing mock drills. We do them at the airport. We've done them at the Van Andel Arena before to practice.
Right. That's the reality. Roy, let's talk stroke. We haven't gone there yet as far as action items when we feel a loved one might be having symptoms of a stroke.
Sure. I think one of the greatest things is for people that are close to that individual, whether they're friends, family, or strangers, is being more aware of the signs and symptoms. So weakness, stuttering, not being able to formulate their sentence structures. Strokes take on so many different signs and symptoms, it's unbelievable. They can be extremely minor. They can be just everything from just kind of not feeling right all the way through to literally going unconscious. And it can depend on whether it's a blood clot or a plaque clot or some other type of emboli, all the way through to a bleed or something like a hemorrhage or an aneurysm. What we do though is oftentimes tell the community it doesn't really matter that you can't diagnose what it is or how severe it is. You know something's going on. So as doctor was saying, don't hesitate. Activate EMS. You can always have them get there and say, this wasn't quite what we thought it was. I think it's safe. They seem stable. I understand you were scared. Go ahead and drive them to the ER. We think that's okay. Or the ambulance will do that for them so they have a backup. But you can never speed the ambulance back up again. And we find out now when it comes to reperfusion with stroke studies that the faster we can get that stroke patient in, get that embolus clear, if it's truly an embolus type stroke, the faster the recovery, the less damage that can occur. So we're treating it much more like we did the aggressive heart attacks now. So we want to recognize early, we want to get them in to get them treated early. And as I always say too, don't do it yourself. The ambulance gets you straight into where you need to go. We can ask permission to go through red lights and go around traffic jams. You can't do that in a car. And you don't know where the roads are blocked. We do, in the ambulances, have that privy to us. What roads are closed? Where do we need to go for an alternative route? So let's stop driving those people in ourselves unless the doctor or the paramedic says to, and get them in for treatment, or at least review to make sure it's not something serious.
Great. Just a couple minutes left, Meredith. What else do you need to share? What does the public need to know that's going to make your life easy?
I think a lot of people are real hesitant to call 911 when they're just not certain. A lot of times at 2 in the morning they don't want to wake us. Well, we're awake. We're there. We're ready for it. And even if it's something that just might seem a little minor to you, we want people to dial 911. We would like to be there at their home or at their scene, helping them and just helping them process through what they're experiencing and to make the right decision for them. And we just really would like people to dial 911 if they have any doubt.
Yes. Dr. Olgren?
Well, I just would re-emphasize the stroke. That's something that we do have something to treat people with now. We've got a new medicine, kind of a clot buster, if you will, and other interventions that can be done. So again, if you see a family member who the most common thing is they're going to be weak on one side. They'll drop things out of their hand, or their face will droop on one side, or they can't say words, or they're slurring their speech. Those are the common signs. There are others, but if people recognize that and realize that's time sensitive, because we only have a few hours where we can give the medicine.
Yes. Find you at St. Mary's, yes?
St. Mary's, yep.
Not that I want to be your patient,
Oh.
but you know,
I
that's where
understand.
you'll be. Where do we find you?
I work for American Medical Response.
Great. So thank you for what
Thank
you
you.
do.
Thanks.
And how do we find out about Roy Shaw and his team?
Our training is free, everything from basic life support all the way through advanced life support. And all of our basic life support, CPR and first aid is free. So visit us online at protrainings.com, and you can find any of our videos for free, because we just can't put a price on life.
Great. Well, that's a good way to end. Thank you all for what you do.
Thank you.
Thank you for watching.